City of Hamilton has entered the gray lockdown category of the provincial framework. This move to the lockdown category is an unfortunate, but I think necessary measure in order to protect the health and well-being of everyone in our community. We are experiencing a surge in COVID-19 cases, including variants of concern, and additional restrictions need to be implemented to help lower the spread of this virus. These provincial orders are decided by the Premier and the Provincial Medical Officer of Health. And yes, our local medical officer of health is consulted, but ultimately it's the Premier of Ontario and the Medical Officer of Health of Ontario that makes the final decision in terms of what's open and what's closed. And I'm going to share some highlights of gray lockdown category and remind everyone that a full list of restrictions is on the hamilton.ca/coronavirus on our website. So to begin, no indoor organized public events and social gatherings, except with members of the same household. Individuals who live alone, including seniors, may consider having exclusive close contact with one other household to help reduce the negative impacts of social isolation. The limit for outdoor organized public events and social gatherings where physical distancing can be maintained are set at 10 people outdoors. And for restaurants, bars, and food and drink establishments, indoor dining, unfortunately, is prohibited. Outdoor dining and takeout and drive-through and delivery is permitted. And I will say that our planning staff who have been dealing with the applications for outdoor patios have accelerated their efforts, and hopefully in the coming days, we'll have many restaurants able to restart their patios outdoors for outdoor dining, and hopefully the weather will cooperate with that effort. Indoor sports and recreational fitness activities, unfortunately, again, are closed, and the outdoor recreational amenities are open with restrictions. So again, please visit .ca/coronavirus for a fulsome list of restrictions under gray lockdown. We must take these steps now, required to protect our hospitals from being overwhelmed and every person in this city from spreading the virus. So thank you to everyone who continues to do their part by following our public health measures. You're making a significant difference. And with Easter weekend upon us, I will remind everyone tuning in that our next media briefing will take place on Tuesday, April the 6th. And in keeping with Easter weekend, remember our community will be in the lockdown category of the province's COVID-19 response framework for the holiday. And as a result, it's extremely important to follow the gathering limits. Celebrate only with those in your immediate household. And if you're feeling well, or if you aren't feeling well, stay away from others and get tested. And sadly, due to these restrictions, the city will not be issuing permits for any organized Easter egg hunts at city parks this year. Limits for religious service rites or ceremonies are 15% capacity of the room indoors and 50 people outdoors. I know that Paul will speak more to these details in just a few moments. Events and religious services, rites, or ceremonies are permitted when done virtually, and I encourage those community members observing Easter to make plans in this manner wherever possible. Actually, to do it now, because it's critically important that we stay virtual. And once again this year, that it will mean celebrating virtually to help reduce the risk of community spread of COVID-19 for most, if not all, of our events that are happening in our community. So I'll now pass it on to our Emergency Operations Center Director, Paul Johnson, for some additional details. Paul?
Thanks very much, Mr. Mayor. And just to build on a few of the things that the Mayor went through, just a reminder for the community that our City Hall and Municipal Service Centers continue to take appointment-based services. So those do continue in the gray category, but they are by appointment only. So just give us a call at 546-CITY, and we can arrange for an appointment-based service to take place. But given that we're encouraging people to stay at home and not go out unless it's absolutely essential, recognize that many of our services, in fact, the vast majority of our services are available either online, over the phone, and in ways that do not require you to come in to make an appointment. But for those who need to, you can certainly make an appointment, and we'll accommodate that as best we can. The mayor talked about recreation impacts, and it is unfortunate after just getting our pools and some of our swim programs up and going. Those are, of course, all closed, but we continue in earnest to be planning for our outdoor activities. Our golf courses at Kings Forest and Shadoak are scheduled to reopen in mid-April, and over the next week or so, we'll have some more precise dates as they get those grounds ready. Winter golf is over, so this is our chance to prepare our golf courses for turning into the spring and summer and fall activities. We will be opening all of our outdoor courts, the hard surfaces that have fences, this coming weekend. And so for those that are interested around tennis and pickleball and basketball, what better time to reopen our basketball courts than the Final Four weekend of the NCAA tournament? So that's going to happen as well. And we are on schedule, as usual, to look at our playing fields being ready for openings and bookings early May. That's always weather dependent. And that will, again, we'll have more information as we head towards there. And our recreation division is planning for a full slate of summer recreation activities, including our outdoor pools, our SUPI programs, splash pads, and summer camps this year. Those may be restricted in some ways in numbers and things, so looking at where we are in terms of the provincial framework and any other local health impacts that we need to take into account. But our goal is to have a much more regular looking summer schedule. Folks will remember last summer, it was very much a modified schedule. We also have lots of virtual programs, and as the mayor suggested again, it's we're encouraging wherever possible people look at those virtual offerings. They're just another layer. If you can't get outside or the outside stuff is not what you want to do, we do have these virtual programs that are available no charge. The Senior Citizens Without Walls program and some youth programs, and it's all on our website if you go to hamilton.ca/recreation. One closure that we didn't mention in our public press releases is that our Gage Park greenhouse must, under the gray category, be closed to the public, and it is. In terms of places to worship, one of the reasons that we're focusing on that, of course, is coming up to Easter weekend. And just a reminder that the 15% capacity of the rooms that are indoors includes all the people that would be in there. So this is those that would be officiating the religious services, as well as any musicians that are allowed to be there, any people that are supporting the service itself, as well as the congregants who are coming. So it's a 15% maximum, including everybody would be there, and it's based on the building and fire capacity of the building. We had a couple of questions over the weekend about whether it was a different calculation, but no, it's similar to what's been happening in the past. That building or fire capacity that the churches would know for their rooms, those are the or places of worship, those are the capacity numbers that you would be using, and then basing it upon that. Reminder also that, there's no indoor organized public events or social gatherings are permitted after the religious service. So yes, small numbers can gather for the service itself, but none of the other activities after that. Face coverings are required indoors, and the physical distancing for those who are not part of the same household must be maintained. And again, really encourage virtual services. Should that be an option for folks, because that can serve, obviously, far more people. Enforcement, obviously, we will be out fully enforcing the new rules and the categories. You'll see on the website that we did have some charges issued in the final weekend or leading into the final weekend of being in the red category, but now we will be enforcing through the gray category as well. And again, really encouraging for those businesses that are open, follow the rules, please. It was very disappointing to see one business in particular with 7 charges for various offenses over the weekend, and exceeding capacities, failure to ensure face coverings, not taking contact and information, not screening people coming in. All those things are really what can continue to drive cases, and it's just our real hope is that people take this very, very seriously, continue to do all the things for those businesses that continue to operate. One of the things that the City of Hamilton did over the weekend, as you know, is to provide some relief to restaurants in terms of their outdoor dining availability in the gray category. There was a immediate approval of the patio permits that had been submitted and the plans that had been submitted. They were to begin on April 1st, but to give just even those extra few days, the decision was made to have that happen immediately. And this program, as you know, is encouraging local businesses to add or expand seasonal patios and outdoor seating on their property or on municipal property if the zoning and everything works out. These places have all submitted their plans, so the approval is for the plans that they've submitted. Program runs until October 31st of this year. The city has also waived all applicable fees for establishing that outdoor patio. And it was very successful last year. We expect it'll be very successful this year. Hopefully the weather will warm up just a titch. It's a little chilly out there today, but our hope is that there can be some good use of outdoor dining facilities, because we know a very, very difficult situation for restaurants moving into the gray category with now the closure of any indoor dining. So again, really hoping people will follow the rules, do things that are safe as we head into both Easter, as we head into a school break period, a spring break period that was advanced by a month, but coming up in the not too distant future. That, again, think very hard about what you're doing and where you're going and who you're gathering with, and recognize the things you can and cannot do, and try and enjoy yourself as much as is possible in the safest way possible. We'll get through this period. You're going to hear from Elizabeth not only on the new provincial category we're in, but you're going to hear more about our vaccine program and the rollout of vaccine. And that's ultimately the good news. And so it is hold on for just a little while longer while we get more and more vaccine into our community. And then very much we expect that we'll be able to enter into some of these less restrictive categories. So thanks for the work that's going on. It's been fantastic, and people are doing what they can to be safe. We just need to continue to do that and to encourage that along, and when necessary to enforce that. Our bylaw officers will be available on a proactive basis, and also if you have any issues, again, phoning into the city, 905-546-CITY, and you can indicate if you see things happening that you don't believe should happen. And just to ride that point home, we did have a large party over the weekend at a location apparently of close to 200 individuals. And those are the kinds of things where the public can assist us in understanding what's going on so that we can take appropriate action and keep people safe. Dr. Richardson?
Thanks very much, Paul. So just from a case perspective today, we're sitting at 12,568 cases total in Hamilton as of today. That's 63 new cases from yesterday. Of those, 713 local cases that have been screened positive as variants. We have 729 active cases right now, 309 deaths to date. Unfortunately, no new deaths today. We are currently reporting a total of 40 local outbreaks on our website, with 5 new outbreaks to report today. Arby's in Stony Creek, Kiwanis Boys and Girls Club that runs out of Viscount Montgomery Elementary School, as well as Lisgar Elementary School, Lake Avenue Elementary School, and St. John the Apostle Catholic Elementary School, which is a school bus outbreak. Our weekly incidence per 100,000 today is sitting at 113, and a weekly reproductive rate of 1.12. And just a reminder, that's calculated weekly, and so you don't see a lot of change. It's just updated every Thursday or Friday. So generally, as you can see, our case numbers and outbreaks are continuing to grow here in Hamilton, and we are having a growing number of cases screening positive for variants. And as we're looking at this situation, as you know, we've moved into the gray lockdown zone because of the increasing spread. And really, when we're looking at this, there's 2 things that are going to make those case numbers come down, and that is control measures, such as the ones we've been talking about all along, and vaccination. And so we have some time yet before vaccination rates based on vaccine supply are going to get up to a level where it's really going to cut down on the growth in the cases. And so these public health measures that we talk about continue to be the mainstay of what we need to do. So absolutely, when it comes to the variants, there is no difference in terms of the effectiveness of the public health measures. We just need to be very, very adherent to them. We need to be strict with them and make sure we are following those. So again, staying home if we're unwell, getting tested for COVID if you have any symptoms that that you think are related to COVID-19 or have been in close contact with somebody who's a confirmed case of COVID-19. When we're talking about getting together with people, and as we look at the holidays that are coming up, we have a confluence of holidays, of course, from across a number of religious groups. And so making sure that we're celebrating those just with our household members is very important as we go forward. While there is some ability to have some celebration in our religious buildings, it is very important that anything that happens outside of that, as Paul mentioned already, really is just kept to our own household members. And remember too, if somebody needs to come into your household, whether it's to come and fix a problem with the furnace, or whether it's somebody who's coming to give services or care services to somebody who's at home and requiring them, wearing a mask with somebody who's not from your household is very important, as well as keeping 2 meters or 6 feet apart. And hand washing, as always, remains a staple when we're looking at these issues. I do just want to talk a little bit as well about our April break that is coming up, our March break that is now our spring break in April. We very much urge families to be putting any plans to travel on hold for now, whether that's just travel about the province or to visit other family members, but rather organize to stay at home locally, spend time with those in your immediate household, and do all the things that we've been talking about as we have gone through this pandemic. And Paul's talked a lot about the recreational opportunities outdoors, hiking, bike rides as the weather improves, being out on our many paths and trails, visiting a park, or doing some sort of virtual event together with family, those sorts of things. They are very important things to do as we all get through what we hope is the final surge in cases here with COVID-19, knowing just how fatigued people are. But these are opportunities to be physically active, to connect with family, and do what we can as we go through this time. On the vaccine front, as of today, we've administered over 90,909 vaccines, making that 14.6% of those people over the age of 16 here in Hamilton who have received a vaccination to date. Just want to talk a little bit about sequencing. And so right now, we're in a spot as a province where there are variations in terms of how sequencing is rolling out in different parts of our province. So for the North, they're having a hard time because they've been working with the Moderna vaccine, and the shipments of that have been delayed. They're having a challenging time even in vaccinating those that are over 75. Here in Hamilton, we're fortunate. We were able, as of this morning, because we've had sufficient vaccine, we've had sufficient appointment slots, we were able to go to the 70+ group. And as well, there is some sequencing that's going on related to the patterns of spread that we're seeing in various areas. So you'll know that we went ahead and vaccinated, for example, those in shelters here in Hamilton, offered vaccines to those who live and work in shelters. And that was because of very significant concerns about the shelter system and the hospital system being destabilized because of cases that were happening in that group. So you're going to continue to see this to some significant extent as we move forward, about there being slightly different approaches based on what's happening in communities, based on the systems that are being used and the ability to fine-tune sort of distribution groups, as well as the vaccine supply and uptake locally in terms of what people choose to do. We do know provincially there is a desire to get to some more standardization, but it is difficult to be both responsive and similar at the same time. So as I said, as of this morning, we are able here in Hamilton to offer vaccine to those 70 years and older through all of our large-scale immunization clinics, as well as our mobile sites that are moving around through the community. As well, we continue to have the AstraZeneca pilot amongst our primary care, some select primary care offices that has been there to see how that can potentially work. And we are expecting some updates from the province very soon around the potential for pharmacy rollout here in Hamilton of the AstraZeneca vaccine once they get that shipment in on a provincial level. So people can go to the provincial online booking tool that you find at www.hamilton.ca/vaccine booking to schedule an appointment at one of our large-scale clinics, whether that's at First Ontario Centre, at St. Joe's West 5th Clinic, or at Hamilton Health Sciences large-scale fixed-site clinic. Of course, anybody who does not have access to the internet or computer or a valid Ontario photo card can call in to our hotline at 905-974-9848, press option 7, and book an appointment through that route. But as we do, particularly as we have a change in who is eligible, we do tend to see a large volume of people going to the website, a large volume of people coming to our call center. And so it really is important that if you have a way to book that appointment yourself online or to have a family member help you, please do that and reserve those spaces on through the hotline for those who don't have computers, who don't have internet access, or who don't have a health card and need some help to do that. And a reminder, of course, that all of these clinic sites are appointment only and walk-ins are not permitted. At our 6 pop-up vaccination sites, you can also book through our hotline at this point. We are hoping to be able to move to something online shortly, but at this point, we're still working through the hotline system. So these concepts, the concept of pop-up clinics very much is to move about the community, not to be in a place for any length of time, but they will return to places as we go through them. And, we've had inquiries about, why have we got 3 fixed sites and others have more fixed sites? Well, we chose this approach of vaccinating through 3 large sites right now, expanding to a 4th with Rosedale shortly, and then being able to move throughout the community so we could cover more of our community than we could with single clinics that were opened in various areas. So that is the concept behind those, and we'll continue to offer those as we go through. They'll also be going back, of course, for second doses when people become eligible for those second doses. So just want to make a comment too about our webpage and where you'll find our facts and stats on our cases. You would have received an email earlier today about enhancements that we're making to that webpage, and I just want to make sure that that you're aware of it. So we've had a fairly static display, if you will, and we've been working hard with our colleagues in IT because getting numbers out and making sure that as much information as we can is out there on the web, both for our media partners as well as for the public. We've introduced a new Power BI dashboard that gives all of our COVID-19 surveillance information in that tool and can hopefully give you an easier way of negotiating it, moving around it. And several other health units had already made that transition to the dashboard, and we've been able to implement that now here. So you can filter through, sort out things, toggle between different views. What hasn't changed, of course, is the scope of data that's available to you. All of the information that was there to you before are continue to be there, but hopefully these will be ways that you can manipulate it more easily and some more visual sort of viewing of it. So that's it for me, Mr. Mayor. I'll turn it over to you.
And Mr. Mayor, we just have you on mute there.
Yeah, I'm using my button here. Okay, thank you. Thank you, Dr. Richmond and Paul. Thank you very much for the information. And I do want to share with people that we're getting emails and calls today about people that are using the online booking system very successfully. In fact, one gentleman called and said he called in at 8 o'clock and got his appointment to get vaccinated at 10. So it's moving quickly. We are still limited by the volume of vaccine that we're getting. So, why are people were asking, why don't we vaccinate more people? Well, we can only vaccinate as many people as we have vaccine for. And I think our position has been until such time as we get clear confirmation of vaccine availability, we're not going to open up the next tranche of vaccine eligibility. So thank you all for your patience. And I know these are tough recommendations that we're back into now based on the increased numbers. But I think the province continues to make calls that they believe is necessary. And I think there's no disagreement here that, these are measures that are helpfully going to protect health and avoid continued spread, which also is going to help ensure that we don't overtop our healthcare system, which is experiencing challenges for sure. Easter and Ramadan is upon us, and it's certainly a time that we all want to celebrate. And I encourage you still to do it virtually with family and friends. I know that's hard and it's difficult, but in this challenging time, it's necessary. So whatever you can do to ensure that you're staying within your own household or having that virtual gathering or doing it outdoors at physically distanced and masked, as the Friday hiking tradition might encourage you to do, you can do it safely by just making sure that you, from folks that are not in your household, that you continue to mask and stay physically separate, and you can appreciate one another's company at a distance. Tough issues, very difficult for us to continue to swallow. I know there's fatigue out there. I fully understand it. I think we all do. We don't necessarily want to be in this position, but at the same time, not taking the appropriate steps would lead to much more illness and much more potential death, and that's certainly not something that anyone would countenance. So thank you for your ongoing efforts. Continue to check on your elderly neighbors, those that might be shut in or don't have family nearby, to make sure they're doing okay and have everything they need. And do check into the hometownhub.ca for additional shopping opportunities. Fortunately, this time around, we have somewhat of a level playing field for all retail, so that we don't have the big box stores open and everything else shut down. So there's still capacity for all stores, but we need to ensure that all retail outlets follow the rules, make sure they have folks physically separated, and that they follow the capacity limitations that are attached to their retail openness opportunity. And on that note, Jasmine, there's lots of questions, I'm sure, so we'll turn it over to you for some additional media questions. Thank you.
Great. Thank you, Mr. Mayor. We have 4 media joining the briefing today, so we'll start with 1 question and 1 follow-up for everyone. The first question can be to Nicole Martin from CHCH. Nicole, you can go ahead.
Hello, everyone, and thank you for taking my questions. I had a chance to walk through First Ontario Centre today with my 70-year-old dad who got the shot. It was a really smooth process, so congratulations to all of you. I'm just wondering how many seniors 70 and older were actually able to book a vaccine appointment today?
Thanks, Nicole. That's great to hear that you were able to get your dad there to the clinic today and had a good experience. And I think the people who are running these clinics are really doing a fantastic job. There's a lot to do, and they're big sites, and it's great to hear. In terms of how many went through, we were able to have 700 people booked into that clinic today. So we're anticipating they will all be moving through. So as of about noon today, I think we were up to 700. So we are able to accommodate last minute bookings as well. I know some clinics elsewhere in the province are not, but it's great news that we're able to do that.
And my next question is, are you noticing any vaccine hesitancy in the community? I'm just wondering if you have the total number of eligible seniors who have not yet booked an appointment, why that might be. I know last week in Ontario, they released there were about 200,000 seniors in the province who have not booked a vaccine.
Yeah, so we're continuing to go through and look at those numbers and see where they're at as we just try to, it's a bit of a challenge with the system that we've got to sort out who's in long-term care, who's in the community. But overall for those 85 plus, we're sitting at over 75%, and we'll continue to look at the numbers as we go through this week. So I think that there was excellent uptake that we saw in long-term care, and we went through and validated that with a special survey that staff did with the long-term care and retirement homes. I think uptake, we tend to see this curve where there's a rapid uptake, and then it kind of slows down a little bit over time as people, make the necessary adjustments or take the time to make the decision that's right for them and their family. And so very much encourage that people do that as we go forward. So we're always looking at vaccine confidence though. And as we are thinking about these things, talking about the science, the updates that come out, making sure people have all the information that they need to make the best decision that they can.
Thanks, Dr. Richardson. Next question will be to Lisa Pileski from CHML. Lisa, you can go ahead.
Hi, thanks very much for taking my questions. First one would be for Dr. Richardson. Just wondering about vaccine waste. I know you've said that supply is an issue in Hamilton, so there may not be a lot of waste, but we are seeing, regions like Toronto had a wait list over the weekend to kind of use up those unused doses. Just wondering if there is any issue in Hamilton with people not showing up for an appointment or something like that, and is there any concern about waste?
So in terms of the vaccine, these are absolutely valuable resources, and you can appreciate why people are so concerned in terms of using them absolutely the best way that we can. So in Hamilton, we have been quite fortunate over the weeks. Our vaccine supply is very, very tight. For a given week, when we're operating at 3,000 plus doses a day, we're using, over 21,000 doses. And certainly if people don't show up at their appointments, and we're not seeing very much of that at all, we're really just talking in the sort of 1, 3, 5 sort of range of doses that, if we had to open a vial and somebody didn't show up or something like that, but they're very, very closely monitored and used. And if there is a case where there are extra doses in the vial, then we look to the people who are around that site to see who it is could come and use that. So if you think about the St. Joe's Clinic, are there other people who are 70 plus in the hospital who might be able to be vaccinated? And so each site looks at what they're able to do. As we move forward and we're doing more and more at the public clinics, we're continuing to expand that strategy in terms of using up any sorts of residual doses. So as we add to sites, that potential, does grow a little bit, but as you can see, it's very small numbers that we're talking about as we go forward.
Okay, thanks very much. And then my second question would be for Paul Johnson. You did briefly touch on the charges that were laid under COVID-19 restrictions at the End Zone Bar and Grill, as well as a Church on the Mountain. Just wondering if you could elaborate on that. I know there's been some concern about the church in particular. There was something circulating, a video of a service that showed people not wearing face coverings. And just wondering if you're pursuing any other charges related to that, or if that's pretty much it at this point.
So I don't know whether further pieces will be pursued. I know our folks always look at these things and make determinations. You saw stories about another restaurant establishment that had some additional measures from things that happened a couple of weeks ago. So the ability for us to take further action is always there as is warranted. I think the general message is it's just very disappointing when people choose not to follow guidelines that are there for the safety of folks. And then in this case, it's not, well, we didn't want to follow them and nothing's happened. It's we didn't want to follow them. In the case of the church, things have happened. And when it comes to restaurants, and I read about charges where, not enforcing mask wearing and having too many people and not having physical distancing and having music up loud, so that means people have to speak louder without masks on. Those are all the things that these are things we've known we shouldn't be doing for a while, and so it's always disappointing to see that. I think that the way to work through this is, as a community, get our collective numbers down. If you go online and look at what orange and yellow and ultimately green look like, there are many fewer restrictions and we can do a lot more things. The time now is to work within the framework, and many of these activities, I understand indoor dining is now closed, but many other activities are still allowed to function in a safe way. So let's follow those measures. Let's follow them even after you get your vaccine, and that will continue to stop the spread. But in terms of additional measures we may be taking, some of that will depend on if people continue to break the rules and we continue to have to lay charges. I know our folks have, throughout the pandemic, not been afraid to take the next steps, which may lay further restrictions on individuals who are, again, just putting people's safety at risk. And their reasons for it are fine, but our folks are there to enforce the rules as they're written, not to take people's opinions and then say, okay, you can go and do what you want to do. So we will continue to enforce, and people are very good at sharing information with us when there are these egregious examples, and we will follow up on those as they continue to go. It's the people that inform us of large parties. It's the people that inform us of establishments that are clearly not following any of the rules, or it's really outside of what would be, a minor slip or something like that. And our folks are quick to respond, and we will continue to. There is no backing off of enforcement as we move through these next number of weeks.
Thanks, Paul. Next question will be to Maria from the Hamilton Spectator. Maria, you can go ahead.
Thank you very much. I wanted to ask, so Dr. Richardson, about, we were hearing reports that there were some problems making vaccine appointments, which resulted in few people being on the list today at First Ontario Centre, and perhaps the reason why people could book up last minute. I was wondering if you can comment on exactly what was the nature of that problem and the source of it.
Thanks, Maria. There was a glitch with the provincial system and getting the vaccines uploaded, and that happens on their end, and it's resolved now. It was noted by staff and provincial staff over the weekend that had happened, and they worked together and got it resolved.
Okay, and I was also wondering, for people who may have traveled to a clinic to get their first dose, but did so with some level of difficulty, and later, if mobile vaccines became available in their facilities, or they learned about, eligibility to receive a vaccine at home once that option is available, will those people be eligible for receiving their second dose in that way, or are they required to make that trip to the clinic again?
Thanks, Maria. So right now, the way it's set out is that where they have to book their second dose at the time they book their first dose, if they're booking through the provincial tool, or we're helping them to book in that way. So as we move forward and get to that time period, of course, some people are going to experience a change where they're not able to get out to that clinic. So there may be some limited circumstances where there's an ability to make some adjustments. However, to do that on any sort of scale, as you can imagine, the challenges that we've had in booking, our whole 530,000 population into clinics, to think that we'll be able to move very many of those appointments in the future, that will be very, very challenging to do. So that if we're looking at that, that's going to be reserved for cases where there's a very good need to do, unless something changes with the system overall.
Thanks, Dr. Richardson. Our next question to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much. Hope everyone had a lovely weekend. My question is for Dr. Richardson. Dr. Richardson, you had spoken out against lockdown before Hamilton was put into gray by the province. What do you think about that decision to put Hamilton into lockdown?
Thanks very much, Joanna. And, I think it's really important to note that in the comments I made to the Board of Health and to GIC, we talked about what had worked during the second wave, and that it as we saw that march through the control measures from red to gray to a shutdown, province-wide lockdown, to the full stay-at-home order, it really wasn't until we got to a province-wide lockdown that we saw the curbing of our numbers, as well as then with the stay-at-home numbers seeing everything drop. So definitely I've been saying that we are going to have to move forward with a broader range of control measures. It's just a matter of how widespread those are and exactly when they happen. So I think as we look at the numbers and where we're at and the stresses that we're seeing, particularly on our hospital systems and what we're seeing happening in the GTHA, we need to move forward. We need to move forward in terms of control measures. I think there's going to continue to be broader discussions. You've seen from the province, they're talking about making more control measures available to the Chief Medical Officer of Health, so that they can bring about further changes based on what's happening locally, and that's what we're going to experience as we go through. As I said earlier, this is really a piece about public health measures and how strict they're going to need to be as we're getting vaccine into arms.
Thanks so much. My second question is also for you, Dr. Richardson. It is being reported right now that the National Committee on Immunization is recommending a pause on AstraZeneca for people under age 55 for safety issues. What do you think this is going to do to public confidence with this vaccine? And what do you want to get out to the public about this vaccine?
Thanks so much, Joanna. I think, as we go through and are doing these large-scale vaccination campaigns, what does happen is they do what's called post-marketing surveillance. So we go through all the safety trials, all the work that's done with a vaccine to get it approved and get it out for use. And then, as I've talked to you about before, we continue to look and see what the trends are as we go forward. And of course, we're doing this around the world simultaneously, all at once in this case. So when it comes to this piece, with the ongoing rapid reviews by Health Canada and by the National Advisory Committee on Immunization are very important to do, allow us to make adjustments as they're seeing trends and do what's best for Canadians as we move forward. So we understand that those guidelines will be released later on today or perhaps early tomorrow morning in terms of what they're seeing. I think it's really important as we go through this program that people continue to watch and see the information that comes out as the program rolls out. And we'll continue to make adjustments as we see information that comes forward. We understand it can be disconcerting for people in terms of trying to understand the vaccines and what to do with them. But it is an absolutely critical part of any kind of program to do this kind of surveillance and make adjustments as we go forward.
Thanks, Dr. Richardson. Our next question will be to Fallon Hewitt from the Hamilton Spectator. Fallon, if you're ready, you can go ahead.
Hi, thanks for taking my questions. My first question would be for Paul Johnson. Can you tell us a bit more about that party that you briefly mentioned over the weekend? Like where it was, if it was maybe in an Airbnb, were there any charges laid?
So I don't have those details. I'll have somebody from Bylaw. I got those details verbally, so I'll have somebody from Bylaw follow up with whatever details we have, and if there is a business involved, then that will show up on our website as well at the appropriate time. If it is a private residence, then obviously it won't, but they can give you a little bit of detail and give you the quantum. But my understanding is it was a lot of people, upwards of 200, that were at this gathering, and they're doing a bit more looking into it to see whether the establishment is also a business type establishment, which would lead us to perhaps additional charges as well. But we'll follow up with you. It's just a reminder that these things shouldn't be happening. And if you're a business and you're renting out space or giving out space for this, you shouldn't be doing that either.
And my second question would be for Dr. Richardson. Dr. Richardson, like this report of obviously like a large party, I guess, and the rising case counts in Hamilton, obviously just going into the gray zone. I guess how concerning is that for you with, I guess, turning the tide and trying to go back to red?
Hi, Fallon. Absolutely. This is why these sorts of things are very concerning. As I said earlier, there's two ways that we're going to curb the number of cases and ultimately the number of hospitalizations and deaths that are related to this virus during this resurgence that we're experiencing now, this third wave. And so one of those is through public health measures and the other is through vaccine rollout. And we're, a couple of months away, 3-4 months away from having sufficient vaccine supply and coverage to get us to that place where public health measures aren't going to continue to be the critical pillar that we're relying on to control disease spread. So seeing people make these kinds of choices, it's definitely disappointing. It does go against the Reopening Act. It's illegal. And we're really hoping that people, by far the majority of people will make more sensible decisions during this time for themselves, for their family members, and for our community.
Thanks, Dr. Richardson. We have a bit more time, so we will run through questions one more time. I will start with Nicole Martin. Nicole, if you'd like another question, you can go ahead.
Thank you. I do just have one more for Dr. Richardson. We have talked to some seniors who just don't feel comfortable going in a large clinic. Will there be a time when a senior can go to a pharmacy or to their family doctor to get either Pfizer or Moderna?
So right now, I can, appreciate that some people don't like the idea of going to a larger site. I mean, this is where the pop-up clinics might be something that is a bit more comfortable for them in that they're smaller in scale than are the large mass immunization clinics. And so that's another option that people can look at. Right now, as we go down through the program, and then what we see for the foreseeable future is that Pfizer and Moderna will continue to be the vaccines that are used in these larger clinics. They're more difficult to handle in terms of their cold chain requirements, the freezers, the thawing, the holding that is needed on those, and the timelines in which they need to be have vaccine put in arms in order to avoid the wastage that we were talking about earlier. So I don't see that coming up anytime soon. And so I would really encourage people not to wait, but to make the arrangements they can. Certainly the way we organize the clinics in terms of making them accessible to people, but also from an infection prevention and control perspective, they are organized so that that is absolutely maintained. It's a critical part about why they are appointment-only clinics as well, is so that we make sure that people are spaced out in time as well as in distance. And so I would really encourage anybody who is eligible for the vaccine to consider getting it as soon as possible.
Thanks, Dr. Richardson. We'll go next to Lisa Pileski from CHML. Lisa, if you'd like another question, you can go ahead.
Thanks very much. Just wondering if, Dr. Richardson, you might be able to comment on the outbreak at the Salvation Army. That one's been active. It's currently the most longest active outbreak right now. What's the status there? Does it look like it might be coming to an end anytime soon?
Lisa, when it comes to those kinds of specific outbreaks, I'm going to ask Jazz to work with us to get some further details on that one for you if we can.
Thanks.
Okay, next question will be to Maria from the Hamilton Spectator. Maria, if you'd like another question, you can go ahead.
Hi, thank you so much. So my third question is also for Dr. Richardson. You mentioned a survey being done on vaccination rates in long-term care and retirement homes, and I assume you're talking about the same one, which the table is available online for through the city's website. I was wondering if you could comment on how that survey was conducted exactly, because we've been hearing from some facilities questions about where the numbers came from and comments that they were never contacted by public health.
Thanks very much, Maria. These surveys were done with the facilities themselves, and so the staff made contact with the facilities and gathered the facilities through them, and so that is where the data has come from. In terms of going forward, we'll look eventually. We know that ultimately that becomes dated information in terms of that was information that was gathered at the end of February, very beginning of March. And so we'll be looking at whether we can use information from the provincial tool, which is so far proving challenging, or going back to redo that survey at some point in the future to update the numbers, because it is important to realize that that really is a month old now, that particular survey.
Great. Next to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Thanks so much for the extra question. Mine's for Dr. Richardson. We've been hearing from some relatives of people in assisted living. And so I was looking to find out, has that rollout started there yet? Like, what is the procedure going to be to vaccinate people in assisted living, as I believe they are also in phase 2?
Thanks, Joanna. And this cusp of phase 1 going into phase 2, we're kind of at a time where we're transitioning the age groups. The province is transitioning the age groups, but not yet transitioning all of the different populations that fall into phase 2. And that's because we know that age is the primary risk factor when it comes to severe disease and to death. And so while we continue to start down into the age groups that are in phase 2, we haven't yet moved forward. We don't have the vaccine supply to move forward with vaccinating other groups that are in that phase 2 piece. So we are working on it. Able Living is, as you pointed out, part of that phase 2 rollout, and we're working on what our clinics will look like as we go forward. We're doing the planning, but that is we're not at a definitive state with that piece yet.
And next question to Fallon Hewitt from the Hamilton Spectator. Fallon, if you'd like another question, you can go ahead.
Hi, thank you. This question would be for Paul. I was just looking at the city's list for COVID like rule breakers and so on. And there's a number of charges for the End Zone Bar and Grill, which is in East End Hamilton. And like they range from exceeding maximum capacity. There's a couple of face covering violations, as well as active screening and contact tracing. I guess, would you be able to sort of reflect on that or tell us anything about what was going on there on, I guess that would have been Saturday evening or just Saturday in general when they had those charges laid by bylaw?
Well, as you can see by the list, there's not a lot left that they didn't break, and I don't say that for a comedic effect. It's really disappointing. These are big gaps in that. When you're talking about exceeding the maximum capacity, that has this whole piece that cuts down, and things like playing the music too loud, which then gets people talking, and indoor dining, which I know now is prohibited. So we won't be dealing with this in this case or in other restaurants until we come back out of the gray category. But when those volumes of music go up, people have to speak louder. We all know that. And the reality is, if you're eating or drinking, you are without a mask. And so all of that can lead to, wider spread of droplets and things like that. So there's good reasons that these are in place. Face covering violations and obviously the screening and not collecting the contact information. So, again, think about it from a public health perspective, and you only need to look to Oakville. A large outbreak that occurred at a restaurant there. Over 200 people, I think, was the numbers there. And if you don't have information, you're not able to do that contact tracing. You're not able to understand who would be at risk. And those are really critical pieces to controlling the spread of this virus. So if I reflect on it, when I see multiple charges being laid, that just tells me that there was no real attempt to be in line with the Reopening Ontario Act and all the things that lots of other businesses are doing. And quite frankly, when these things happen, it just doesn't look, it hurts those that really try hard, because those that are following all the rules and doing all the right things, you can get the impression that this is the way all restaurants act. It is not. These are the exceptions, not the rule. But when you look at that number of infractions, the word that always comes to mind with me is it's just disappointing that someone would choose to not adhere to the rules across that many different things. Is very disappointing, and we hope when we come out of the gray zone that this establishment will reflect on that. I think it's pretty unlikely that we would come out of gray and go right into no need to do anything ever again. So they'll have time to reflect, and when we do open for indoor dining, we'll expect full compliance.
Great, thank you, Paul. Mr. Mayor, that's the end of our media questions for today, so I will pass things back to you.
Thank you, Jasmine, and thank you to all of our media partners who continue to share this important information with folks in our community. And Bill Custer's Cable 14 and Clear Cable always do a terrific job making sure that these media advisories run smoothly. So thank you for that good effort. As always, more information on COVID-19, financial supports, and any updates, you can visit our website at hamilton.ca/coronavirus. And again, please continue to follow all public health measures. They work and help stop the spread of this virus. We want you all to have a wonderful Easter and a Good Friday, but we want you to do it safely to make sure that we all do our part to hopefully get us to more vaccines, and to some sense of normalcy in the very near future. So see you at our next media briefing on Tuesday, April the 6th at 3 p.m. In the meantime, have a great week. Thank you.